Hello students, today we are going to learn about sexual disorder. So let me give you a brief introduction. In a simple language, sexual disorder is a persistent, recurrent difficulty in sexual response, a person's desire, orgasm or pain. That is called sexual disorder. When you have persistent and recurrent difficulty with sexual response, desire, orgasm or pain. So let's start further. Introduction. According to ICD-10, gender identity disorders of sexual preference and sexual development, and orientation disorders are listed under disorders of adult personality and behavior F6, while sexual dysfunctions are listed under behavioral syndrome associated with physiological disturbances and physical factors, which is F5. It is a disturbances in sexual desire. So definition: any disorders involving sexual functioning, desire or performance. Or sexual disorder is difficulty experienced by an individual or a couple during any stage of normal sexual activity, including physical pleasure, desire, performance, arousal or orgasm, as I told you earlier. Now let's see classification. So first one is gender identity disorder, psychological and behavioral disorders associated with sexual development, so-called paraphilias, and sexual dysfunctions. So we will be going to see one by one. Gender identity disorder. So what is gender identity disorder? In this disorder, the sense of one's masculinity or femininity is disturbed. They include transsexualism, gender identity disorder of childhood, dual role transvestism, and intersexuality. So, we will be seeing this in little bit detail. What is transsexualism? So in this, there is a persistent and significant sense of discomfort regarding one's anatomic sex and a feeling that is inappropriate to one's perceived gender. The person will be preoccupied with the wish to get rid of one's genitals and secondary sex characteristics and to adopt the sex characteristics of the other sex. What are the treatments? Treatments includes counseling to help the individual reconcile with the anatomic sex, and sex change to the desired gender, sex reassignment surgery in selected cases. So what happens in transsexualism? A person wants opposite sex features on them. Next is gender identity disorder of childhood. This is a disorder similar to transsexualism with a very early age of onset. Dual role transvestism. It is characterized by wearing clothes of opposite sex in order to enjoy the temporary experience of membership of the opposite sex, but without any desire for permanent sex change. In transsexualism, what happens? They want opposite sex characteristics, but in dual role transvestism, just they will be wearing opposite sex clothes and they will be enjoying temporary experience. So this is dual sex transvestism. Intersexuality, the patient have gross anatomical or physiological features of other sex. For example, Turner syndrome, congenital adrenal hypoplasia. Psychological and behavioral disorder associated with sexual development and maturation. First is homosexuality. So in this, sexual relationships are maintained between persons of the same sex. Female homosexuals are called lesbians and male homosexuals are called gay, as we all know. What are the treatment is there for homosexuality? Is behavior therapy, in that aversion therapy, convert sensitization and systemic desensitization. We have already talked about this in earlier lectures. Supportive psychotherapy and psychoanalytic psychotherapy we can use. Disorder of sexual preferences, ICD-10, F6 or paraphilias, DSM-5. In paraphilias, sexual arousal occurs persistently and significantly in response to objects which are not a part of normal sexual arousal. These disorders include fetishism. Sexual arousal occurs with a non-living object which is usually intimately associated with human body. The fetish objects may include bras, underpants, shoes, gloves, etc. So a person will be fantasizing things by observing non-living objects in fetishism. Transvestism. Sexual arousal occurs by wearing clothes of the opposite sex. In this, they will be wearing opposite sex clothes. Sexual sadism. The person is sexually aroused by physical and psychological humiliation, suffering, or injury of the sexual partner. Sexual masochism. Here the person is sexually aroused by physical or psychological humiliation or injury inflicted on self by others. In this, what will happen? Sexual masochism is a intentional participation in an activity that involves being humiliated, beaten, bound, they will be tied or otherwise abused to experience sexual excitement. So this is sexual masochism. Then exhibitionism. In this, a person is sexually aroused by the exposure of one's genitalia to an unsuspecting stranger. Next one is voyeurism. This is a persistent or recurrent tendency to observe unsuspecting person naked, usually of the other sex, and engaged in sexual activity. So this is a voyeurism. This is frotteurism. This is a persistent or recurrent involvement in the act of touching and rubbing against unsuspecting, non-consenting person. It means a person is touching or rubbing against without any consent of the opposite person. Pedophilia. This is characterized by persistent or recurrent involvement of an adult in sexual activity with pre-pubertal children. Then Zoophilia involving in sexual activity with animals. It means in this a person is involved in sexual activity with animals. And eutrophilia, sexual arousal occurs with urine, feces and enemas. So this was all about the disorder. Now we will be moving towards treatment. What are the treatment available? So behavior therapy, in that aversion therapy we can use. Drug therapy, antipsychotics have been used for severe aggression and associated with paraphilias. Sexual dysfunctions, what they include? Sexual dysfunctions is a significant disturbance in the sexual response cycle which is not due to an underlying organic cause. So the common dysfunctions are frigidity, absence of desire for sexual activity, that is called frigidity. Then impotence. This disorder is characterized by an inability to have or sustain penile erection till the completion of satisfactory sexual activity, that is impotence. Premature ejaculation, ejaculation before the completion of satisfactory sexual activity with both the partners. Non-organic vaginism, an involuntary spasm of lower 1/3 of vagina interfering with coitus. And non-organic dyspareunia, pain in the genital area of either male or female during coitus. What are the treatment available for this? Is psychoanalysis, hypnotherapy, hypnosis, group psychotherapy and behavioral therapy. So what are the nursing interventions for patients with sexual disorder? Is assess patient's sexual history and previous level of satisfaction in sexual relationship. Also assess patient's perception of the problem. It means we need to ask about sexual history, previous level of satisfaction of the patient with his or her partner and sexual relationship. Then assess for any medications which might be affecting libido. There are many medications which reduce your sexual activity or sexual interest. So you must ask about those medications if they are taking. Then assist therapist as necessary in a plan of behavior modification to help decreased variant behavior. And refer for an additional counseling or sex therapy if required. So this was all about sexual disorder. Thank you.